Efficacy of bisoprolol in the treatment of arrhythmias, a systematic review. Beta blockers have long been successfully used for the treatment of both supraventricular and ventricular arrhythmias. As on date, there are no review studies of bisoprolol in arrhythmias. A systematic review study by Murison et al. Analyzed the current existing evidence for bisoprolol in the treatment of both supraventricular and ventricular arrhythmias. Out of 325 studies, 28 were considered relevant to the current topic. The systematic review study results were as follows. Bisoprolol for the treatment of supraventricular arrhythmias. Bisoprolol efficiently lowers heart rate in patients with atrial fibrillation. Bisoprolol prevents the onset of atrial fibrillation in patients who have undergone surgery, both cardiac and non-cardiac. If beta blockers are started before surgery, bisoprolol may be considered as first choice to reduce the burden of both supraventricular and ventricular arrhythmias after cardiac surgery and substantially reduce the burden of supraventricular arrhythmias after non-cardiac surgery. Bisoprolol for the treatment of ventricular arrhythmias. Bisoprolol reduces mortality and the number of hospitalizations due to severe arrhythmias in patients with stable heart failure. In CIBIS-2 trial, fewer sudden deaths were observed in patients on bisoprolol versus those on placebo, 3.6% versus 6.3% deaths. Bisoprolol administered early, less than 4 hours after myocardial infarction, lowers mortality, reduces the number of episodes of ventricular arrhythmias and major adverse cardiac events in patients with NSTEMI. Bisoprolol efficiently reduces the ventricular arrhythmia burden in patients with premature ventricular contractions or PVC. Sugimoto et al. Study more than 50% reduction of PVC burden in 7 out of 16 patients on bisoprolol. Kobayashi et al. Study reduction of 88% of PVC in 5 out of 12 dipyrrolidinol respondent patients. Conclusion: current evidence supports the use of bisoprolol for the treatment of supraventricular arrhythmias, especially for rate control during atrial fibrillation. Bisoprolol is effective in both primary and secondary prevention of ventricular arrhythmias.